Welcome to Bending Over Backwards with James Adkins, where each week we take a deep dive into what it takes to break through barriers and change the game, whether it's in medicine, business, or life. Today, I want to talk about two things: AI, UnitedHealthcare, and claims denials. We all probably remember this AC/DC song from the 70s. Dirty deeds, done dirt cheap, dirty. You guys get it. Dirty tricks provided by insurance companies to deny medically necessary health care. We're all aware of what recently happened with the CEO of UnitedHealthcare, Brian Thompson. Brian Thompson was heinously murdered by a deranged individual on the streets of New York and left behind two children and a wife, a widow and two children without a dad. It's beyond despicable. The deranged individual who did this, I'm not going to give the courtesy of mentioning his name. However, from all of the press accounts and people that have been interviewed about this murderer, what we have heard is that he was a highly functioning human being. He went to Ivy League schools. He got a degree from Penn in engineering. He was a highly functioning human being who seemingly was doing pretty well. Then something happened. His interaction with his health insurance company, he had a failed surgical spine case, something bad happened, and he went off the deep end. We all know about that. What you may not know, however, is that UnitedHealthcare in 2023 profited $23.8 billion. Some of that money was made by denying medically necessary health care. Furthermore, UnitedHealthcare is the largest insurance company in the country. You may not know, in November of 2023, a group of patients in the state of Minnesota filed a lawsuit against UnitedHealthcare. I'm sure there are many people suing UnitedHealthcare, but this lawsuit got my attention. It's because it involves spine care. These patients sued UnitedHealthcare in the District Court of Minnesota for two things. Number one, denying medically necessary spine care and spine surgery. And the second thing, for kicking elderly patients out of rehab hospitals before they should have. UnitedHealthcare is using an AI tool called NH Predict in order to do this. Reportedly, 90% of the software has errors in it. So NH Predict, which has a 90% error rate, reportedly, is being used to deny medically necessary care to patients and to kick elderly people out of rehab hospitals. There's a lot of pressure and a lot of stress in the healthcare system today. And part of it is because of the ridiculous denial habits of these large insurance companies. Patient safety and enhanced medical decision-making is the promise of AI. That's what us human beings are excited about with this technology. The misuse of AI to deny medically necessary care is a troubling intersection between technology and humanity, to say the least. This promise of innovation is overshadowed by the risk of overlooking individual patient needs. We have to be careful with this technology. Another dirty deed done dirt cheap by UnitedHealthcare is to withdraw, or what is commonly known in the community, actually claw back payments that they had previously made to physicians. Patients can't believe this, but this is true. Insurance companies, specifically UnitedHealthcare, because I have personal experience with it, will go back inside of a physician's bank account and claw back money that they have previously paid for healthcare. I know that's hard to believe, but they do it. In 2020, they did it to us. They clawed back $175,000 for medical services for endoscopic spine surgeries that we provided patients in 2018 and 2019. I didn't even know they were doing it until almost 2021. And here's the downside. Forget about what the physician giving care for free. The downside is the chilling effect it had on our spine program. After UnitedHealthcare clawed back those payments for legitimate surgeries authorized before we did them, clawed that money back, and by a contractor taking those funds from a bank, we decided to do what? No longer operate on UnitedHealthcare patients unless they paid for it privately. So a patient pays premiums. They pay thousands of dollars a year, sometimes thousands of dollars a month, for a policy that they are trusting that UnitedHealthcare or another insurance company will be there for them when they need it. When they need the surgery, We tell them, sorry, you're going to have to pay for it privately because we cannot trust your insurance company. So if you think you're in good hands with Allstate and State Farm is your brother, you can count on State Farm, you are dead wrong. Insurance companies are big business and they don't want to pay claims. The cat is out of the bag. Everyone knows that today. So we have to reform the insurance industry. Another dirty deed performed by insurance companies is this. I'm going to give you a real world example that occurs in our practice on a daily basis, probably multiple times a day. The physicians talk to me about this, and it's going to baffle you. So a patient has an injury. Maybe they fall, they get in a car accident. They have a severe injury to their spine. Maybe they're having spasms and radiating nerve pain into their leg. They've got a significant problem that needs immediate care. They come in our office, our specialist evaluates them, records their exam findings, and we submit an authorization to UnitedHealthcare to ask them if they will approve an MRI for the patient. The patient, by the way, has no idea until we share this with them. Your insurance company has 7 to 14 days to deny or approve this diagnostic test that the physician just ordered. So, patient leaves the office, we give them some oral medicine to help them with their pain until we can get their MRI performed. 2 or 3 days later, the patient calls us back and says, hey, I need to get my MRI. I'm in trouble. I'm in severe pain. I have to get back to work. And we say, we submitted the authorization to your insurance company. We requested an authorization. They have 7 to 14 days to deny this. So somewhere between 7 to 14 days, we'll get a yes or a no. If it's a no, what ends up happening is a patient has to come back. They have to come back to the office, get another evaluation, hopefully submit more information to get their MRI approved. Or the second thing that can happen, a peer-to-peer conversation where a specialist in our office who ordered the MRI will talk to a doctor from the insurance company to see if she or he can convince that physician of the necessity of ordering the MRI. Meanwhile, the patient's still at home suffering. Here's a dirty trick the insurance company play. They do it all the time. Guess what happens at 2:30 on Wednesday when our specialist takes time out of his day or her day to talk to the doctor from the insurance company? No phone call. Doctor doesn't show up. So our physician goes back to work. Then the insurance company may call when the physician's with the patient. They intentionally sandbag us so that we can't actually do a peer-to-peer. That happens. That's a dirty deed done by insurance companies. Now, let's say that that patient eventually gets their MRI approved. Maybe we're now at 14 days. Guess what has to happen? They've got to get on the imaging schedule for the imaging center in order to get their MRI done. That may take a day or two. Let's say they finally get their MRI done. Then they have to come back to our office for us to review that MRI with them, to share with them what their pathology is, whether they need an injection or a procedure or a surgery. Guess what happens in that visit? After the evaluation, the plan of care is given to the patient. We submit another authorization for that injection or that surgery. Guess what? UnitedHealthcare gets 7 to 14 days to determine whether they're going to authorize that procedure. Meanwhile, the patient's at home getting more frustrated. So patient calls our office and says, hey, I waited forever. I got my image done. I need this surgery. I need this injection. What's going on? We say, we submitted the authorization to your insurance company. So patient calls the insurance company. Now, many times patients don't understand this, but there's really two sides to an insurance company. There's the claims adjudication, the authorization side of the insurance company, and there's the side of the insurance company called member services. Member services, you may be talking to somebody in the Philippines or India. They'll tell you anything they want. The patient calls the insurance company, hey, I'm waiting, I'm suffering, I need to get this procedure done. And the member services person speaking to them goes, oh, if your doctor submits an authorization, we'll approve it immediately. Meanwhile, we did already submit the authorization and they're just obfuscating. So again, more distrust between the provider, the patient, which works for the insurance company. The patient can't fire their insurance company. Their insurance company is usually provided in a group health format. So they may have to wait a year to get out of that health insurance policy. Maybe they fire their doctor because they think that their doctor's not doing her job, when in reality, it's probably the insurance company doing everything they can to prevent the authorization of a procedure or a surgery. It's a daily occurrence. It happens all the time. Fortunately, we will do peer-to-peers to get diagnostic tests and to get procedures and surgeries authorized. Unfortunately, many physicians won't, because here's the other dirty deed performed by your insurance company. When we call to get an authorization, oftentimes they will tie up our staff for 45 minutes to an hour on the phone, passing us from person to person to try to get that authorization. Let's say we get lucky and 4 weeks or 6 weeks later, the patient's procedure is finally authorized. Can you imagine how ticked off the patient is by that point? They've been in pain with radiating nerve pain, severe pain in their spine, and they've waited for 6 weeks or 4 weeks to get a procedure. They're more than angry, and rightly so. That complicates the relationship between the physician and the patient even worse, creates distrust. Subsequently, let's say the patient is lucky enough to get their surgery performed and we get it scheduled and they recover. That's a beautiful thing. However, if they've had to wait for 6 weeks or 8 weeks or however long the time frame has been, sometimes the patients develop other problems. They develop complications. Give you an example. If we have to put the patient on an opioid for a period of 4 to 6 weeks while we're waiting for them to get a surgery, guess what happens? Sometimes the patients become dependent on the medicine. So there are many, many problems when insurance companies obfuscate, use AI, et cetera, to deny, delay, and prevent patients from getting adequate health care. In closing, I would encourage you, if you have a spine-related problem or you're trying to get an authorization for a procedure, to work closely with the authorization team at your physician's office, to not assume that the physician's office is not doing their job. Sometimes they're not, but it can become adversarial because the insurance company likes it that way. The more adversarial it is, the less healthcare that's provided. So work with your physician. Don't quit. Don't throw in the towel. You as a patient have rights. You have more rights than you realize. And if you fight with your insurance company and you put pressure on them, there's more likelihood that you're going to get the necessary procedure that you want. I'll give you one last piece of advice. This is what the spine specialists in our clinic tell me. Frequently, when a patient comes in the practice that has a radiating herniated disc or severe spasms or nerve pain in the back of their leg, what the physicians will tell the patient is this: hey, I can get you in the surgery center in a few days. If I order this MRI, you're liable to wait a week or two to get the MRI. After that, you'll have to come back in the office. You'll have to wait maybe another week or two to get a procedure. You could be 1 month out, lose your job, develop a problem with opioids, and end up getting complications because you're simply waiting to have that nerve decompressed or that procedure. So what the physician will say is, you can just pay cash. Well, that works for people with resources. But what if you're a middle-class person, or you're a lower middle-class person, a poor kid like I was? What do? You can't get that care. So ultimately, this starts to cause further problems in the healthcare system where the rich get healthcare and the poor don't. The middle class don't. Again, it's a big mess that needs reformed. I would suggest, again, working closely with your physician and not assuming that your medical practice is a problem. It's oftentimes the insurance company not wanting to pay claims. The last thing I would suggest, if you want to be proactive, consider talking to your congressman. Now, here's a challenge. Many of the Congress people we have, congressmen, senators, representatives, many of those people are what? They're on the payroll of an insurance company. I'm exaggerating, but they're being paid off through lobbyists, through special interest groups to make sure that the insurance company retains power. So complaining to your congressman is probably a good idea, but oftentimes they're in the tank with the insurance company. So it's a mess. If you have a spine or pain-related issue, if you've been denied from your health insurance company, reach out to us. I'll do what we can to assist you. We will guide you any way we can and fight for you to get that necessary spine procedure or surgery or injection that you need. I hope you found this helpful and informative. If you have a spine-related issue that's not resolving, if you're having problems with your insurance company and you want an advocate to fight for you to do that peer-to-peer, reach out to us and we'll do what we can. Thank you.